Our next startup to present is EcoBio Consulting Private Limited.
I'm going to talk about this at the end, but just wanted to kind of rattle the room on insanity's definition being different to different people, but I'm going to come at the end, on why did I put this. My name is Prasad Phadke. I'm the founder and CEO of EcoBio Consulting Private Limited. We have two brands, EcoBio Traps and Movie Traps. Today I'm joined with my another co-founder and colleague, Vidhi Sangvi there. She's sitting in there for any of you to interact with us later. Dengue, malaria, chikungunya, naam to suna hi hoga, right? What we are in an endeavor is to protect lives and protect environment, both, not saving lives, carefully choosing words, protect lives and environment from the world's most deadliest predator, which actually is the mosquito. Itna sa chota sa 5 mm ka machhar is responsible for deaths more than the sum total of all wars that humanity has fought, including the wars that are currently happening. That's the realistic data. We have a big problem in India. The PM has put out a vision of malaria mukt Bharat by 2030. Dengue mukt Bharat hoga nahi. That's reality. But वो control में लेके आ सकते हैं. There are reasons why dengue मुक्त भारत मुक्त क्यों नहीं होगा. But malaria मुक्त भारत हो सकता है. We have the national vision towards malaria elimination. And so what are we trying to do to solve the problem today? Okay. 127 years back, malaria was discovered in Sikandrabad, India, not in Africa, by Sir Ronald Ross. And for last 125 years, we are using bed nets. We are using these repellents. We are beating them one by one by clap of hand, or these rackets. These boys here have rackets apparently in this hotel, right? We are using repellents on our body lotions and bunch of them. But still the problem remains as it is, right? And that's insanity, right? Do the same thing again and again and again, and the problem still remains. So if you have to solve problems like these, we figured it out that you got to go to the root, right? एक एक करके कब तक मारेंगे, भगाएंगे is a game of musical chairs. You repel them away, they're going to bite somebody or the other, right? So we decided to break their chain, to focus on the source. And the reason we decided that is because we very missed a very important part on what science is screaming and telling us, okay? The rate at which mosquitoes multiply beats by a factor of 10 to COVID. And the reason we came out of COVID was not vaccines. Vaccines prevented us to get into ICU and the further disaster, right? But the reason we came out of COVID is because all of us were confined in that contained zone of our houses, of our room, for those 3 or 5 days. So science tells us when you have a massive force multiplier, the way to arrest that problem is you break the chain of the transmission cycle. And what we are doing in case of mosquitoes for last 100+ years is either killing them one by one or repelling them away. One mosquito bite results in creation of 3 crore mosquitoes. Because only a female mosquitoes bite, she breeds only in water, and at any given point of time, she lays 500 to 1,000 eggs, and her lifespan, human lifespan 70 to 80 years, her lifespan is only 15 to 30 days, right? The science has been screaming to us saying, break the chain, and what we have been doing is repelling them. So what we decided is, to mimic the breeding ground of the mosquito by introducing, this product made by recycling corrugated boxes. Very simple way. All you have to do is just add water. You can see a sachet inside. The sachet does two functions. One is of attracting and second is of killing. So you attract the mosquito over here, the female mosquito. She breeds only in water, right? There is an attractant which ensures that she attracts here rather than any other water body. And then the killing ingredient ensures that no adults emerge out. So the 500 into 500 into 500, or you break the chain of its transmission, the future generations, right? One of these covers 400 square feet and lasts for 30 days. And is a primarily outdoor product. So we took this and put it in Dharavi, and I'm going to come to that in a second. But basically on how this works, a quick video of 10 seconds, if you can have the music on the laptop. Yeah. So you can see her now resting. See it entering the device. That's where she's laying the egg. These are how those eggs looks like. And they just don't turn into an adult and you break the chain, right? So if you noticed, there is no toxic fumes. It works day and night. Dengue is a day biter, works 24/7, no smell, doesn't require any electricity, no use of insecticide and pesticides, a green way, an outdoor solution like this. And because of the Dharavi pilot that we did with BMC for 3 years, we developed an indoor version of it, because this you can't keep indoor. So an indoor version with a refillable sachet option. So just to change the sachet every month, whereas over here you have to change the entire base unit. This still works outdoors. This is indoors. That's how the products are positioned. Science is the same. The benefits are the same, right? So, we validated during our Dharavi trial. Bangalore asked us to contain a dengue outbreak, which we successfully did. This is some feedback from our Dharavi trial, which was supported with ICMR, NIMR. They validated it along with Nair Hospital and the insecticide department at BMC. Can you just increase the volume?
इस समय तो नहीं तो हमेशा डेंगू मलेरिया से कितने जन अगली साल मरे थे। साल तो बहुत कम हुए। अभी मरे ही। इसलिए मैं बाहर आना मच्छर चला गया। बाहर आना बचावेगा तो होएगा नहीं तो भी गया। पूरा लगाने का बहुत फायदा है कि शाम को भी जो मच्छर लगते थे वो भी नहीं लग रहे और रात में तो डर भी नहीं लग रहा। पहले मोर्टीन लगाना पड़ता था तो भी मच्छर काटते थे मोर्टीन से। मगर अब नहीं, अब मोर्टीन भी नहीं लगता और मच्छर भी नहीं काटते हैं।
इससे मच्छर के या जो डेंगू का जो भी है वो मसला हल हो।
If they breed, we all bleed. इको बायोट्रैप करे जड़ से सर्वनाश, ताकि आप रहे खतरनाक बीमारियों से दूर.
So we tested in the most difficult terrain. Then these are some of our commercial customers. We partnered with Rent-to-Kill PCI, Pest Control India, to distribute this product. And these are some of our customers over the last 2-3 years of journey. Bunch of press coverages that we had. Till date, we have been able to protect 5 million lives, around 3.5 lakh customers, and, saving 950 metric ton of carbon footprint. Wow. And about 450 square feet of landfill diverted. Sustainable Development Goals aligns with most of the UN Sustainable Development Goals in the effort that we do. Some of our customers who take pride in sustainability. Apart from, you've talked about it, world's leading scientists who have come on board, Padma Shri, the AP Dash, the only second Padma Shri in vector control. If you have heard of vector control initiatives like the Gambi and Gapusia fish, that's Dr. Susanta Kumar Ghosh. And one of the reasons which at ICMR who made happen the India's indigenous vaccine from ICMR front, Dr. Rajnikant also. Can we have the sound of the...
head of the policy and communication divisions of the Indian Council of Medical Research in New Delhi. And movie trap is a attractant for the mosquitoes, and it can help in the prevention of the dengue, malaria. The Mumbai Municipal Corporation, they have played an important role for the testing, and this project have been tested in a community like Dharavi, and Dharavi it showed a 90% decline in the mosquito bites. So I hope that this project will be a game changer for the mosquito control in urban areas.
And if you look at one of the most prone is, our schools, the BMC schools. So, if you look, the data says that, less than 15 years, 1 out of 3 children is with dengue. There is no vaccine available for dengue, no treatment available. It's a day biter. Quick wrap on our journey, featured in the tank. We've now distribution with Rent to Kill PCI, expanded internationally, augmented into an indoor product, now developing a next version early warning system with AI. That's work under progress, and that's what the ask is for. 5 crore, really using most of that for scaling of the consumer version of the product. The B2B with Rent to Kill is quite established, but this is going to be a different ball game altogether, because now it's affordable at the repellent pricing standpoint, and then some investments in developing the early warning system for AI. That's it. Thank you. We'll win this war with science, weapon, and all of your participation. Thank you, ladies and gentlemen.
Okay, the Dharavi experiment, did anyone track how many actual cases of malaria dropped while that experiment was going on?
Yeah, we tracked it at the local level. There was drastic reduction, but there is a WHO protocol which does not allow us to compare directly the vector impact versus the disease incidence. So there is no direct correlation.
Sure.
Although if the
Let's
population
assume there's no causality or correlation for that matter. Is there a change in the numbers?
Oh yeah, there is.
Of reported malaria cases?
Oh yeah, there is. In fact, in the citizen feedback, the CAP survey that you do before and after very clearly came out कि पहले बहुत cases हुए थे, ये साल कुछ भी हुआ नहीं. That's reality.
No, that's still self-reported.
Sorry?
Is there a tracking? Like, is there a BMC hospital near Dharavi that has officially?
So every
sort of
ward in
mentioned
BMC
that
has
number-
data of year-over-year
malaria
cases. Yeah,
having
the cases.
gone down.
Yeah,
Do we
yeah.
have this
Yes.
number tracked somewhere?
Absolutely. The
What
ward
are the
offices.
before and afters?
Sorry?
What are the before and after numbers?
Of the diseases.
Of
the
malaria,
disease.
number of malaria incidents reported at hospitals
Yeah.
before and after the project was done.
So the data is not captured hospital-wise, but ward-wise, and in that ward where you did the pilot, almost all 80% reduction in dengue and malaria cases. Yeah.
So that sachet is what your key thing is, right?
Yeah, the heart is in the sachet. You're right. Yeah,
Okay.
the heart is in the sachet. That's the reality.
And what does it do? It attracts only the females, or?
Yeah, it attracts only the female. There is an attractant here, a mix of a proprietary, formulation of hay leaf infusion, which we have not patented, which we'll never patent, because we all know the thing about patenting. Yeah, that's the attractant.
And then she lays the eggs in there.
Here,
and then-
compared to any other water body over a period of time, it weans.
So, and this sachet is okay for 30 days is what you say?
Absolutely.
And typically how many females might be laying eggs? Any idea?
It depends on the mosquito density over there. We have seen as close to 10,000-15,000 eggs also being laid.
But not all mosquito bites can lead to malaria, right? So capturing those malaria mosquitoes would be the key.
There are 2 species. One is Anopheles stephensii, which causes malaria. Aedes aegypti and Aedes albopictus. The Aedes families causes dengue, chikungunya, Zika. It's like you have a gun, but the bullet is not there. What you are referring to is the bullet, right? But if there is a gun, somebody pointing at you, you just do not know if there is a bullet inside or not. It's a chance. So you have to, still catch the species. The PCR, like we did the PCR for COVID, will determine whether it had dengue or malaria inside of it or not. But you never know.
So then will this lead to all eradication of all mosquitoes?
Not happening, sir. eradication of mosquitoes on the planet not happening. As long as there is
That
water
will
on the
yeah, that will
you
just,
have to continue to reduce the mosquito population again and again and again.
Okay, okay. ठीक है.
Eradication not happening.
Thank you.
Just one question. Since you said that sachet is the key thing and that's your core IP and that's the product and that is doing the magic, if that is the case, why sell all the bucket and all other things? Just sell those sachet, make 12 sachets or whatever for the month and then it's done.
Absolutely, sir. That was exactly what, the reason of augmenting into this and the sachet business model was exactly what BMC asked us exactly to do that, right? But the problem is that if the sachet is not used in a base device appropriately, okay, like, you throw it anywhere or whatever. So for example, I'm sorry, what I'm going to say, Sashibala ma'am, I'm going to be very, very sorry, okay? BMC issues us an order of 10 crores, right? Done. Sachet idhar baat gaye. Okay. Nobody uses it in the right manner. Then the next day press headline, I don't have to tell you what it will be, right? Which is
No, that we all
use
know.
case.
See, I've worked a lot on this malaria control piece. Even if you give this mosquito nets, people use it as fishing nets. So that
Absolutely.
you don't have control.
Yeah,
Right?
yeah.
That's really the situation in India.
Yeah.
But if this is your core, why I'm telling you that is because that core can scale much faster rather than all this paraphernalia
agree.
around it and selling and making all
I
this.
agree.
Just put it in the bucket and it's done.
I agree. Oh yeah, we'll.
I had a different
Especially
thought
for
on that one.
B2C, that can scale because people will use it responsibly.
Yeah, we'll have to do IC communication, all of that, on how to use it. But absolutely, that's it. It's a yeah,
Like,
as
could
long
you
as we
technically-
tell them how to use it.
Could you technically spray this on our lakes and then like Vihar Lake, Tulsi Lake, on the top of the lake and control a bigger piece?
We have not done honestly, I think the guppy and gambusia fishes are best way to control water bodies because, the water keeps on flowing in and then, if the sachet gets misplaced or it doesn't stay in there, then that's an issue. It's more container breeding. I'll be very honest. That's a more fish play effectively. Yeah, and stagnant water too. Yeah.
Last question. How far does 5 crore take you? How far does 5 crore take you in the B2C journey?
In 3 years, about 35 crores is what we have modeled.
Okay.
In 3 years.
Thank you.
Thank you.
You have something to say?
Yeah, just a comment. I think Bihar government, where dengue is a recurring issue, especially Muzaffarpur, they can easily give you that money because they spend, I think, more than hundreds of crores every year without any control.
Where we are getting to that is, and one of the things that you guys were discussing, what really when it comes to healthcare is not per capita cost for health, okay? So we have now with this sachet model, what Mr. Modi said, per capita per person cost comes less than BedNet. And then it fits into the equation. Now we have to build that parameter to say, okay, per capita per person, which is used by public health is a bed net, which only protects in night. Dengue is a day biter. And add that economics over there, then the mandates will happen.
No, I am saying a very different issue. One presentation there would give you this without anything.
Oh, if it would, Mr. Sinha, I'll connect with you offline right away and with the Bombay Chamber. Thank you.
Yeah, that's perfectly right.